Another procedure for acne scar treatment that sometimes patients bring it up, but it's not very well known. It's called saline injections. So what saline injection is that we take bacteriostatic saline, which is practically just water, but this is sterile, and we fill it up with, we fill a syringe with it, and what we do, we go into acne scars and inject the acne scars with the bacteriostatic water. Now obviously your body is going to absorb that water within basically several hours, so the point is, why do you do it? So the concept is that when you have an acne scar and when you put the needle in it and basically injecting it with water, the pressure of the water is stretching out the acne scar. And if you were to do this many times over and over again, you'll actually stretch out those acne scars over time. It does work quite effectively for some patients. It works more for Boxcar scars than anything else. Again, multiple treatments are required. It's typically not my first treatment option. It was first reported by a dermatologist down in Fullerton, Dr. Sawyer, who actually I happened to train under years ago, and that's how I learned the procedure. Again, overall, a good procedure, but definitely not my top choice of treating acne scars with. Again, my top choices are the laser resurfacing, TCA, and Subcision. Side effects are pretty minimal, just risk of bruising. Again, it's pretty much just water that you're injecting and trying to stretch out the acne scars. Although it might not be ideal for all patients, it might make sense perfectly for some patients that don't want to put anything artificial into their skin and don't want to use any acids or lasers, so this is a great alternative, especially for darker skin individuals.